You're watching the Randy Alvarez Business Report. I'm Randy Alvarez. Today's topic for dentists, specifically, how to have a thriving practice in the new economy. With us, we have an expert on the topic. She is a dental consultant, Lorraine Guth. Lorraine, welcome
Hi,
to the
Randy.
program.
Great to be here.
So for people that don't know you, who's your typical client and what are the different services you offer?
Great question. I work, about half of my clients tend to be periodontist,
Okay.
and half tend to be GP, which I find a great balance for me.
You like periodontists, though.
I
Before
do
we
like
came on, you
periodontists.
said because they think differently.
They think differently.
Really?
Yeah, yeah.
Like what? Give me an example.
Well, their work
More
is...
scientific thinking, or?
No, their brain works differently. It's almost difficult to describe, but they see detail in a different sort of level. And they have to see detail, but they also have to look at broad-based things that are happening in relation to their staff, their patients, and their referring doctors. So I find that they have a really intense ability to focus in an extreme way and then stop and then see the world and then go back to that. And it takes an incredible amount of energy. You know, they have to be able to walk in and be really present to a patient and then all of a sudden be in a surgery where they can only focus on this second and moment.
So you seem to attract, you say,
Mm-hmm.
the successful periodontist, but for whatever reason they're not fulfilled. It's
Yes.
not going the way they planned.
It's not going
Elaborate.
the way they plan. You know, I'll hear things like, I work really hard. I thought that this would be great at this point, and I'm tired, I'm stressed, and I just want to have some time with my family. Or here I am, and I just want to be able to do a great job in the clinical therapy I provide, but I've got all these staff issues. I've got patients pulling at me. It was funny. I remember watching one of my clients. I could tell whenever he was done with surgery because I could hear and feel the whole office move behind him saying his name. It was like, Randy, Randy, Randy. And it's that incredible stress they carry. And so part of what I help them with is learning how to manage being productive and happy and make a great living, but organize themselves so that it's a little bit more peaceful for them. And they go home, they're better.
Okay, good. So what are the different services you offer? And then I have specific questions on those
Okay.
things.
The different services I work, you know, it's very different depending on the practice. So I have some practices that call me and they'll say, I don't care about numbers. I want to find a way to make my organization feel better so that we can implement better and deal with stresses. That's one of the kinds of services we look at. The other type of client I have is I work with general practitioners quite a bit, and I would say they fall into the category more of they've done well, but they're stabilized and they want to make the next plateau. And
You also work with GPs.
I do. They're so much fun as well. The typical GPs I work with, usually they're successful. They're at a plateau though, and they need to reach the next level. And they have a whole group of people that have made it to this point with them. So now the challenge with that is even a little different because we have how do we participate with insurance? Do we do that? What's happening with corporate dentistry? How do we market? How do we structure ourselves? So that's a lot of fun to take really a strong, great organization and bring them to where their piece is in this new dental world that we have.
So you help practices, the team work better together.
Absolutely.
And also work better together with the dentist.
Oh, yes. That's a key part.
If you had to say that that's like the biggest issue, at the top of the show, you said that you attract a successful periodontist that's not happy because he's fried, I guess.
He's fried.
He's busy.
Or she's fried. Yeah, they're
Okay.
busy. They're fried. And
So
so,
how do you eliminate that, though? How does that go away?
it doesn't go. Nothing
Is it just
goes away.
processes you're giving them?
That's what they think it is. It's more than
Is that
processes.
that's what they want?
It feels like that's what they want. It feels like that's the answer. But you know, it's often the way we define the problem that's the problem, isn't it? I find the people I work with, they're great problem solvers. They just are running so fast, they don't take a step back and define the problem. What I come in and do is I look at what are the real challenges here, and I help everyone understand what they need to do to fit in with that. Yes, there's process, but it's about how do we work together, and then how do we implement these specific systems and make them function better because we work better together.
Okay, good. Now, people like you, by the way.
Yes,
I read
they
some
do.
of your testimonials. Yeah, I guess you're considered funny.
Yeah.
You tell lots of stories, and you change the way practices, the way the team works together.
Yes.
Is that true?
Yes.
You have a
Yes.
knack for it, you think?
Uh,
I don't want to interrupt too much here, but do you consider yourself that means because we've talked in the green room,
Right,
and I said, how are you different? But you really kind of changed the way they think.
right.
So I'll let you talk.
Well, it's interesting because I can say part of what qualifies me for this is there was a time in my life where I was the really talented employee. I was the one that you wanted to keep. I could put numbers on the books. I could do all kinds of things. And I could tear the team apart in half a day. Now I look back, I realize what a real conflict that had to be for the people I worked with. So, I understand what it is to be in the role of the team member, and I also understand what it is to be in the role of the employer. And I help people learn how to work together better. But it's not kumbaya. We're working on processes and systems. I'm just not working on systems with the exclusion of the real underlying issues that make the systems work. That's the difference.
Now, your referrals, is that how people hear about you? For the
Very
most
much
part, they
so,
go to your
yes.
website and referrals?
Yes, it's word of mouth. It's their friend at a convention, and maybe their friend is having a challenge or upset or wants to blow their brains out before they go back to work, and that's how they hear about me.
So one of the dentists, a periodontist that I know,
Yes.
Mark Silberg,
Yes,
he
great,
thinks
great
you're
guy.
great.
Yes, yes.
So
I've
what
worked with Mark.
separates you? I don't even ever like to ask that question.
Oh,
But why do you think you get better results, lasting results?
one of the things is that I'm really good at giving people bad news, and it's part of what I teach.
Interesting.
It's part of what I teach. And so when I work with clients, I spend time observing, I watch, but I'm really good at helping the doctor hear what they need to hear that no one else will tell them. And in a way that's constructive and that they can act on it and be realistic about it. One of the things I talk to them about is, whatever you want to do, that's okay. It's not okay to lie. So you can say that I want to have this goal and I want to make this happen. But what you can't say is, I want to make this goal happen with these circumstances when those two things don't work together. So I help them come to understanding really about what that is and make a clear decision so that maybe we shift the goal and maybe we adjust the circumstances some, but not all the way. And in the end, we get what we want.
Okay, so measuring results. How do you know when you're doing a good job?
I measure that by my clients. Certainly some of that statistically looking at growth, but for some of my practices, it isn't about certainly numbers and they're at where they want to be. They do get some growth, but it's not the focus. I measure it by growth, but what I really measure it by is when I get letters, like one of the letters I gave you, that, here it's a year later and I can't believe that I have a team that's working without a facilitator. And we're reviewing the book on the 7 Habits of Highly Effective People, and they're all presenting how that will make our practice better.
Okay.
And he said, I never would have seen that happening with myself as a business owner. I also measure by, they're getting along better. I talk to someone a year, 2, 3 years later, I see them, and they still say, my practice is better. I'm happier. I have time with my kids. Life is different now. Or Jane. You should see Jane. 3 years ago, I never expected her to be who she was. In fact, I wasn't sure if I wanted to keep her, and she's now one of my best employees. And I watch her grow every day. To me, those things are significant. I had one day, one of the best measurements I had was an employee called me who we'd had a significant coaching discussion with. And she said, do you remember the conversation we had, such and such? And it was pretty memorable. So I did. But she said, I called you to tell you thank you. She said, I'm a better parent today.
Wow.
It was amazing. So those are measurements that, I don't know, you can't beat.
So do you think that you can help every successful practice become a little bit better?
Absolutely. There's really no end to what can make us better. I mean, if you look at the people we work with, they go to courses all the time on the same things over and over because they want to be excellent and clinically. If you look at the way we function in our practice, why not do it that way? We encourage our patients to do that. We encourage them to come back for preventative maintenance even when they're in good shape.
So if somebody wants to get started with you,
Mm-hmm.
consultation, free consultation on the
Free
phone?
consultation, absolutely. I'll spend an hour with them. I've spent more. Help them sort through their concerns, and at the end of that, we make a decision together what they want.
So on that phone call, could you pretty much tell them at the end, this is what I think?
Oh, yeah. There's some level that you learn later, but absolutely. I ask them a lot of questions. What I find is as they answer the questions, they kind of talk through it themselves and they come to a conclusion about what the real problem is. It's interesting. What I love about that first phone call is I think it helps my clients differentiate not just what they want, but why it's important to them now. And I think that why now is what calls them to action. And sometimes it's simple things like, my son's growing up and I want to watch that happen, you know? So that's what that first phone call is about.